All right. Hi everyone again. Welcome to Softfield Academy's live masterclass. This webinar was organized in partnership with our Lebanese distributor, BioPharm. So welcome to all the Lebanese doctors, doctors from all around the world. Don't hesitate to let us know where you come from in the chat. We love to know where everyone is from. Welcome to Dr Lanfranchi and Dr Sebban. Thank you for teaching tonight. I'm gonna start by speaking a bit about Softfield and our products, and then I'll introduce a bit more our speakers. Okay. So Softfield is an international brand with customers in more than 90 countries. Its mission is to develop a range of reliable and safe tools for aesthetic practitioners. So Softfield has, of course, a range of micro-cannulas. Softfield also developed the Easy Guide, that is an insertion needle that was patented. We also have 4 cosmetic products and the Softfield Academy to teach about micro-cannula injections. A little bit more about our range of products. So the Softfield Precision range is the largest and most advanced range of micro-cannula on the market. We have the range going from 30 gauge to 22 gauge, that is for face injection. And recently we developed a range for body injection from 20 to 14 gauge. So overall, we have 22 size of micro-cannulas. We also developed the Softfield Easy Guide, that is a universal insertion needle for easier injection. You will see our experts use it tonight, so you can see how to use it. It's obviously very easy, and we have it in 6 sizes. Now a little bit about Topilas. That is a very new product for us. We just launched it. It is a topical hyaluronidase made of 100% of natural origin ingredients, and it allows the skin to recover the ideal hyaluronic acid level of the skin. So Topilas models and unifies the surface of the skin. It adjusts the volume of HA to restore the skin's natural appearance. It smoothes surface irregularity and reduces defects. Now a little bit about Dr. Lanfranchi, who is an Italo-Argentinian board-certified plastic surgeon who worked in South America and Europe, and is the founder of the plastic surgery and medicine in Milano and Dubai. Oh. He's a member of the American and European Plastic Surgery Association, and he has extensive experience in cosmetic, reconstructive, and aesthetic medicine. He's a key opinion leader, lecturer, and trainer in plastic and cosmetic procedures, and he has published a number of scientific international journals and magazines. Dr. Sandrine Sebban is an aesthetic physician from France. She has 20 years of professional experience in the broad spectrum of aesthetics. She's the inventor of several injection techniques, cannula injection techniques, the soft filling technique, the one-point technique, and the stop facial aging method. She's also the inventor of the pilot needle Softfield Easy Guide, and of our new, more recent product that I just introduced, Topilas. She's a global KOL, a trainer, and an international speaker. So thank you for being here tonight. You are tonight going to speak about which cannula to use for which zone. So we will talk about the entire face today, upper face, lower face. But first I wanted to say that this visual, all the participants to the webinar tonight will receive it via email tomorrow to have a bit of a reminder of where to ideally use each of our cannulas. Dr. Lanfranchi, you are first. I let you take the floor. Maybe you want to share your screen now.
Excellent.
Great. Okay, now you can go ahead and share your screen.
Okay. This one. Okay. So, can you hear me?
Yes, very well.
Excellent. So, good afternoon, good morning, good night, good evening, whatever. It's really an honor for me to be here with you today. Long time that I've been using, of course, cannulas. As I like to say to myself, I define myself like something like a cannulist because I really like them. I use them a lot. I will share my experience, my everyday, what I do every day with this large variety of products that we have. I'm a board-certified plastic surgeon, as Hannah already introduced me, so no more words. Of course, I'm a plastic surgeon and I love to do surgical procedures. The trend in the last 15, 20 years is always less invasive procedures. And that's because of the improval of devices, materials, and technologies and techniques. Why not? That's why we are here to share our experience and to learn from each other. It is true, of course, that there are differences between surgical and medical procedures, but there are lots of things that can be reproduced in a non-surgical way that generally we do surgically. And that's particularly for those who are surgeons, we obtain for sure better results, but above all, we enjoy better our work, no? So we know what happens with the passing of the time. We keep on talking about that, skin laxity, volume loss, which is very important and common, and this is something that we can, with fillers, we can give and restore. And of course, the aging phase, with the passing of time, we tend to lose volume, together with losing skin, soft tissue, together with soft tissue ptosis. So this is something we can restore. With fillers, we can lift, and we can, of course, restore volumes, which is very important. For the mid phase, things that we know, and I will talk to you once I divide the face little by little, from the temples to the nose. So the power of fillers, of course, pure cosmetics, we can treat asymmetries, and we can also treat scars, as I will show you. Of course, the best result is when you use, of course, less product for you and for your patient. That's at least my philosophy, and this is the latest trend for sure. With the cannula, we can dose it better, which is something I will show you, no? When you use it. So it's very important and gives you also that. With an increase in the recent years of injectables, of course, hyaluronic acid embolism increased too, leading to serious complications, including, as we know, unfortunately, blindness, movement disorders, skin necrosis, and cerebral embolism, which have been described. So we have to be very, very careful. And of course, we need to respect anatomy. And well, this is the part of our training. Of course, we study, then we practice, and we keep on improving with techniques and materials, for sure. So we know the connection between external and internal carotid system. And this is why we can have bigger trouble if, unfortunately, we have an embolism. So this is what we want to avoid. And this is, unfortunately, what I've seen. This is a case, this woman believed that the cause of this black areas, she defined it, was the ice that my colleague put her after. But you know, it is not that way. So fortunately, I could reconstruct her. But this is something we don't want to see, and this is something we want to avoid, and this is something we have to be very, very careful. Of course, with fillers, we can treat different anatomic regions, and with different possible injections techniques. You choose the one you like more. Personally, with cannulas, I feel better, I can dominate it better, I can place better my product, and I respect better, of course, the anatomy. Why? Because we inject practically everywhere, and as soon as we keep on improving, we can inject everything. If I think what we used to inject 15 years ago is not the same that we inject today, for sure. So, but we have to be very, very careful, because we have to respect the anatomy and we don't have to create embolism or something like that. So highest risk of injection site responsible for ocular complications are glabella, nasal, nose region, nasolabial folds, and foreheads. This is the main classification. Of course, this is an excellent book from 1936, which is it's French, Les artères de la peau, arteries of the skin, and this is something we need to avoid. So whatever we inject, we have at least some risk of getting one of these. So we have to be very careful. Of course, retrograde, this is what we want to avoid. So we start by the glabellar area, in which we have the supratrochlear and supraorbital arteries, from the internal carotid acid via the ophthalmic artery. So we have to be very careful in this area, okay? We have to, particularly if you are injecting the forehead of or the upper eyelid, you have to be very, very careful with that. When we inject the temple, also in this area, we find of course, we use them for temporal hollowing. We have the frontal branch of the superficial temporal artery and, and the middle temporal vein. After crossing the temporal crest, the artery changes plane, so we can find it in the subcutaneous for the forehead. So it could connect with branches of the supraorbital artery. So that means that we can have ocular trouble if we get inside one of these. So we have to be very, very careful. Of course, we can also inject between the two fascias, that is between the superficial and the deep one, as I will show you. And also in this case, we have to respect the superficial temporal artery. Okay, so also with the cannula, for me, is safer. The nose is another complete chapter, because I think it's the most complicated and which we have higher risk of having not only cutaneous necrosis, but also we have retrograde embolism. Of course, we have a connection between internal and external carotid arteries also there. I will show you better in my other pictures. The thing we use most is when we open the nasolabial angle is the columeral artery. We have to be very careful with her. That's why I will show you the technique, how I do it with the cannula. Personally, I prefer always cannula, to be very honest. But in the temple, when I do the deep plane, in those cases when we have a very severe concavity or temporal hollow, in that case I will do the gunshot straight on with the needle, as I will show you. It's like a journey, a cannula journey, as I call it. The indication, the anatomy, of course, are mandatory, using the right product, okay, with the right technique, of course, to obtain better, safer, and long-lasting results. The power of the cannula, why? Because I think is when the detail makes the difference. Why? Because you can play with the flexibility of the cannula, as I show you here. You see, with one entry point, what we see, we play with the flexibility. We can reach practically every part. Of course, you need training. There's a learning curve. But you can reach everything with less, pricking your patient less, which is something that I really like. Of course, if you use your non-dominant hand, you feel it and you guide it whatever you want, as I will show you with some cases that I prepared for you. Also, it's very important to know where this red dot is, because we know where we'll inject. And particularly, it helps me a lot when I'm treating the nose, where really a small quantity and the detail will make for sure the difference, particularly when we are treating asymmetries
you.